Thank you, Mr. Speaker and members of the Senate. Senate Bill 2403 is a continuation of this chamber's efforts to deal with the abuse of prescription medication. It is respectfully submitted that this legislation will expand patient access to a life-saving medication and promote continued collaboration between pharmacists and other members of the multidisciplinary public health team to help ensure effective strategies for the prevention and treatment of opioid overdose. I'd like to give you a little background. Prescription drug overdoses, and especially overdoses of opioid painkillers, continues to be a very important and critical public health issue. According to the Centers for Disease Control and Prevention, 44 people die as a result of prescription opioid overdose every day in the United States. In fact, prescription opioid overdoses killed 16,235 people in the United States in 2013, and drug overdose was the leading cause of injury death in 2013. Among people 25 to 64 years old, drug overdose caused more deaths than motor vehicle traffic accidents. Overdoses can be accidental and the result of legitimately obtained prescription drugs or the result of abuse of prescription opioids or heroin. When administered in time, however, opioid antagonists such as naloxone can stop the effects of these drugs and prevent death. Because pharmacists know and have relationships with patients and their family members who pick up opioid prescriptions, they are in the ideal position to assist with this issue. Senate Bill 2403 aims to increase access to opioid antagonist rescue medications for opioid users and their families through pharmacists and pharmacies, and to seek to prevent opioid overdoses in our community. Because opioid prescription medications are often the cause of overdose, pharmacists are a logical resource in their communities to increase access to opioid antagonists. Designed to increase access to opioid antagonists, this legislation makes pharmacists an additional access point. I would want this chamber to know that at least 24 other states either have active legislation or have introduced legislation to give pharmacists some level of authority to dispense opioid antagonists at their discretion. On October 20, 2014, the National Association of Boards of Pharmacy recognized the need to support programs that involve an active role for pharmacists in expanding access to the opioid overdose reversal drug naloxone. This bill does several things. It authorizes the Chief Medical Officer of the Department of Health to implement and execute a statewide collaborative pharmacy practice agreement specific to opioid antagonist therapy with any pharmacist licensed in and practicing in this state. Under the statewide collaborative pharmacy practice agreement, pharmacists would be authorized to dispense opioid antagonists to a person at risk of experiencing an opiate-related overdose or a family member, friend, or other person in a position to assist a person at risk of experiencing an opiate-related overdose. It requires that before a pharmacist enters the statewide collaborative pharmacy practice agreement with the Chief Medical Officer, the pharmacist shall be able to provide documentation of completion of an opioid antagonist training program approved by the Department of Health within 2 years. It also establishes immunity from disciplinary and adverse administrative actions and immunity from civil liability for the pharmacist who dispense in accordance with the statewide collaborative pharmacy practice agreement. Mr. Speaker, I apologize for that lengthy explanation, but I thought it important because I know this chamber's commitment to fighting prescription drug abuse and the critical role this legislation can play in that endeavor. And with that explanation and to call up an amendment, I move passage of Senate Bill 2403 on third and final consideration.